Without further ado, I'd like to introduce our speaker for today, Mary McCreary. She is the director of the State Health Insurance Assistance Program, known as SHIP, in the New Jersey Department of Human Services Division of Aging Services. She has worked with SHIP since 2005, where she has been involved in health insurance counseling for aged and disabled Medicare populations. She also provides education and training on Medicare for professionals working in social services, legal, insurance, and healthcare fields. As director of the program, she oversees funding and training for over 400 counselors statewide. Mary is a graduate of Rutgers State University with a master's degree in social work, and she earned her BSW from Marywood University in Scranton, Pennsylvania. So without further ado, let's welcome Mary, our speaker for today.
Thank you, Megan, and good afternoon, everyone. So I've been asked to present to you today for people who are new to Medicare, just getting ready to retire, and helping you to navigate the Medicare system. It is a lot of information I'm going to be covering today, and the slides that I'm using will be emailed out to you after the presentation along with the survey link. So you will have a copy of these slides. You don't have to worry about taking too many notes. There's a lot of information. Medicare is a very complicated program, contrary to what most people think. So I am going to walk you through all the different parts of Medicare and the rules that you need to know when you age into Medicare or go on Medicare because of your disability. So let's get started. So first of all, Medicare is a government-sponsored health insurance. So long before the Obamacare came into place, we have had Medicare as a government-sponsored insurance. It was created in 1965, so it's been around for a very long time. The Medicare actually covers 3 different groups of individuals. It covers those age 65 and older. So 65 is the magic number for Medicare eligibility due to age. Some people who are thinking about retiring early, say age 62, is you can start drawing down your Social Security retirement as early as 62, but you still have to wait until 65 to be eligible for health insurance under Medicare due to age. The second group covered under Medicare are people who are younger than 65, but are collecting Social Security disability. So if you are younger and disabled and collecting SSD, after you're collecting disability for 24 months or 2 years, you automatically are enrolled into the Medicare health insurance program. The third group are those people of any age diagnosed with end-stage renal disease. So those with ESRD for short are also eligible for Medicare benefits to help cover the costs of treating their kidney disease or getting a kidney transplant. So those are the 3 groups that are in the Medicare program. Medicare is strictly a federal program. There are no state rules or state dollars that oversee Medicare. It's strictly a federal program, and the agency that oversees it is the Centers for Medicare and Medicaid Services, known as CMS for short. But enrollment for Medicare is done by another sister agency, and that's the Social Security Administration. So when you're ready to enroll in Medicare, you would contact Social Security to do the enrollment forms, and Social Security takes care of collecting the premiums for Medicare. But after that, the administration of Medicare, in terms of processing your claims and paying your doctors, that's handled by CMS. If you work for the railroad, or in our case, New Jersey Transit, you would enroll through the Railroad Retirement Board. Currently across the United States, we have 61 million people enrolled in Medicare. So it's a very, very large program. All of us probably know someone who is enrolled in Medicare at the current time. So it's a very large program. Medicare itself is not just one all-inclusive health insurance. It actually has 4 separate parts, and they're labeled by letter A, B, C, and D. Part A of Medicare is considered your inpatient insurance. So that covers you when you're admitted inpatient to the hospital or admitted for inpatient rehabilitative care. So that's your Part A. Part B of Medicare is the medical insurance. That covers you for most things that you think about when you think about health insurance. Visits to the doctor, coverage for x-rays, coverage for medical equipment like oxygen or wheelchairs. So that's your Part B of Medicare. Those 2 parts of Medicare, A and B, are referred to as traditional Medicare or original Medicare. The other 2 parts of Medicare, Part C and Part D, are considered optional. You don't have to enroll in Part C, you don't have to enroll in Part D. Part C is referred to as Medicare Advantage. That's where you decide to get your hospital and medical benefits rather than through original Medicare. You're going to get it from an insurance company that's contracted with Medicare to give you your benefits in the form of an HMO or a PPO. Now, if you watch any daytime television these days, you are bombarded by commercials trying to sell you Medicare Advantage plans. They do a lot of marketing for those types of products. So those are Medicare Advantage plans. It's part of the Medicare system, but when you enroll in them, you get your coverage from this insurance company rather than through original Medicare. Part D of Medicare is the prescription drug benefits. Now, we say this is optional because some people don't need prescription benefits from Medicare. Maybe you have it as part of your retiree health plan from your former employer. So that's why the Part D is considered optional as well. Now, what's most important that you need to know about A, B, C, and D of Medicare is that each of these parts have different rules for who can enroll and when you can enroll. Each of these parts, A, B, C, and D, has different monthly premiums. So it's not just one cost for your Medicare. There's actually 4 different premiums for each of those parts of Medicare. Then each of those parts have their own deductible. That's the amount of money you would have to pay before Medicare would pay for any service or prescription that you get. So there's a separate deductible for hospital Part A coverage, another deductible for your Part B coverage, and another deductible for your Part D drug plan, all separate deductibles. Lastly is called cost sharing. Each of these parts of Medicare doesn't cover you for 100% for most things. Most things, Medicare pays a portion of the cost of the service, and you have to pay either a copay or a co-insurance. And the formula they use for that is different for Part A, Part B, Part C, and Part D. So I'm going to walk you through all of these different rules and these different costs for each of these parts of Medicare. Now, the first confusing part is when you can enroll in Medicare, original Medicare, Part A and Part B. Some people automatically will get enrolled in Medicare. That would be people who are already collecting a cash benefit from Social Security when they become Medicare eligible. So if you start collecting your retirement benefits from Social Security at age 62, when you approach your 65th birthday, Social Security will automatically enroll you in Part A and B of Medicare and send you that card in the mail. If you don't need your Medicare at that point, say you're covered under your spouse's employer plan, so you don't need Medicare at that point, you can then opt out and return the card back to Social Security. Other people who are not automatically enrolled then would have to contact Social Security at age 65 if you're not yet collecting Social Security cash benefits. You would have to contact Social Security to say you want to start your Medicare, either A and or A and B. That's called your initial enrollment period. It's actually a 7-month window. It's 3 months before your 65th birthday, the month of your 65th birthday, and then 3 months after. So that's your 7-month window to contact Social Security to say you want Medicare. Now, what's very important about this is if you wait until the 3 months after your birthday to say you want your Medicare enrollment to start, there is a delay when they're going to start your enrollment. So for example, if you turn 65 this month in May, but you waited until June to contact Social Security, they're not going to start your Medicare until July. If you waited until July, they're not going to start your Social Security until 3 months later. Okay, so you want to, the timing on when you contact Social Security to start your Medicare is very, very important. Know the rules about what month you should contact them to coincide with the month you want your coverage to start. Next, we have something called the general enrollment period. That's for people who missed their initial enrollment period and who don't qualify for a special enrollment period. So these are people who pretty much went without any health coverage after age 65. And now they decided, oops, I really should have Medicare. They can only do that during this general enrollment period, January 1 to March 31st of every year. Then there is a delay. Medicare is not going to start until July 1. Plus, there's a penalty for enrolling late in Medicare Part B. So really know the rules about when you should pick up Medicare. Most people do know they enroll at 65 or they're going to enroll when they stop working, and that would be a special enrollment period I'm going to talk more about now. You can delay enrolling in Medicare Part B. right? For a couple of circumstances. So if you're age 65 now, you don't have to enroll in Part B. Some people can delay enrolling in it if you're still working and you have health benefits from a large employer. And large employer is defined by Social Security as 20 or more employees in the company that you work for. So if you are age 65 and you're still actively working and the company you work for has 20 or more employees and you like the health benefits you're getting from that employer, you don't have to pick up Medicare at 65. You can wait until you retire or stop working. If you're retired, you're not working, but you're covered as a dependent on your spouse's employer plan, and your spouse is still actively working, and your spouse works for an employer with more than 20 employees. You also can delay enrolling in Medicare until your spouse stops working, okay? So you don't need Part B, and I'm saying that you can, the reason for delaying Part B is because you have to pay a monthly premium for Part B. So you really don't want to enroll in it until you need that type of coverage. So if you're 65 and are still working, have coverage from your large employer, or if you're 65 and retired and covered under your spouse's large employer, you can enroll in Part A. Most people get Part A for premium free. So Part A is extra coverage you're going to get to pay after that employer plan, and it's free coverage. So go ahead and call Social Security, say you want your Part A. You can defer your Part B in these two circumstances until you no longer have that employer coverage from your own employer or from your spouse's employer. When you do need to enroll in Part B is if you have health benefits and you're working, but that employer is a small employer. Say you're self-employed or you work for a small mom and pop shop that have less than 20 employees. In that case, you need Medicare Part A and Part B. The reason being is there's something called coordination of benefits rules when it comes to health insurance. And if you're working for a small employer, the rules say that Medicare pays first and small employers pay second. And whenever Medicare is responsible for paying first for your health insurance, you need both Parts A and B to have the full coverage. The other time you need Part B is when you have employer coverage, but you're not actively working. So say you got laid off and you're currently on COBRA, or you're retired and you're continuing your health benefits from your former employer in the form of retiree health plans. Well, you have this coverage from the former employer, but you're not actively working. So in that case, Medicare is responsible for paying first before COBRA or paying first before your retiree plan. In that case, you need both A and B of Medicare to pay first, or else COBRA or your retiree plan will not pay in full as second position. Okay? So you need Part B if you're working for a small employer or if you have benefits under COBRA or retirement health plan. Obviously, if Medicare is the only insurance you have, you don't have COBRA or retiree plan, you need both A and B to get full coverage, right? Because Part A is just hospital and then Part B is medical. So you need A and B to get the full coverage. Now, to enroll during the special enrollment period, Social Security rules say you have an 8-month window. They say you can enroll in Part B within 8 months of the end of your employer health plan or the end of your employment, whichever occurs first. Okay, so they say when you retire or you get laid off, you've got 8 months to contact Social Security to pick up your Part B without any penalty. However, this rule conflicts with the coordination of benefits rule, because who's covering you during those 8 months? During those 8 months, you might have COBRA, or during those 8 months, you might have a retiree plan. And during those 8 months, COBRA and the retiree plan, they don't want to pay in full for your health insurance. You're eligible for Medicare. So you need to enroll in Medicare right away, both A and B, when you stop working. Okay? When you stop working, you need Medicare A and B to work with COBRA or your retiree plan. Also, you can enroll in Part B at any time while you're still working. So some people say, well, I'm 65, I'm working, I like my employer plan, I'm going to delay Part B. Then your company changes their employer plan. And now maybe they changed it to a high deductible plan. You've got to pay out $5,000 before the plan will pay anything. Or they raise the premium you have to pay for that coverage and you're not happy with it. You can still keep working, but you can opt out of that employer coverage and instead enroll in Medicare A and B for your health insurance. When you enroll during the special enrollment period, there's no late enrollment penalty. Okay? There's only a late enrollment penalty if you are age 65 and then go for a period of time without any health insurance. Okay, I'm going to stop it there. Do we have any questions about enrollment before I move on to the Part A coverage? So you can either unmute yourself to ask a question by clicking on the little microphone there to unmute yourself, or you could type in a question to me in the chat. Okay, I'm not seeing anybody unmuting or no questions coming in, so I'm going to proceed. So I want to talk about your Medicare Part A, the cost and the coverage. So Part A is, again, your inpatient coverage. It covers you when you're admitted to the hospital and pays for the hospital charges while you're in the hospital and all treatment that you receive in the hospital in terms of the supplies they use, the testing that you have done while you're there. Okay, so the hospital charges are covered under Medicare Part A. Part A also covered skilled nursing facility care when you're there for rehabilitation. Medicare Part A also covers home health care services after a hospital stay. Part A also covers hospice care, which is care for people at end of life. And Medicare Part A covers blood if you need some blood transfused. Okay, so that's covered under your Medicare Part A. Part A for most people does not have a monthly premium. It's called premium-free Part A. That's because all of the years that you are working, one of the taxes that comes out of your payroll tax is a Medicare tax. So that tax entitles you to premium-free Part A as long as you have paid into the Social Security Medicare payroll tax for at least 10 years, or in Social Security terms, they call it 40 quarters. Okay, so as long as you have worked in the country for 10 years and paid into the Social Security system for 10 years, you're entitled to premium-free Part A. If you did not have the work history to be entitled to premium-free Part A, it is rather expensive. Right now, it's $471 a month premium for your Part A coverage, but only about 5% of people have to pay for their Part A. Now, the other parts associated with Part A, not only is a premium, but they do have a deductible. And Part A has a deductible that changes every calendar year. Right now, it's $1,484. That's the Part A deductible. So as soon as you are admitted to the hospital, the first $1,484 is going to be billed to you. And Medicare doesn't cover that first amount. After that, Medicare covers the balance. If you're in the hospital for a very long period of time, more than 60 days, then there's a per day rate that you are charged, and Medicare picks up the balance for days 61 to 90 for hospital stay. Now, the thing about the deductible is it's not an annual deductible, it's a benefit period deductible. So if you, you have to pay this deductible again in the same year if you're out of the hospital for more than 60 days and then have to go back in. That's a new benefit period and a new deductible would apply. Okay? And they would start the day over with days 1 through 60, covering the full amount after the deductible. The other Part A coverage is for inpatient nursing home care in a SNF, skilled nursing facility. So say you need a knee replacement and you go into the hospital for a knee replacement and you're there for 4 days recovering from the knee replacement. Then rather than returning home, you need some intensive rehabilitation and maybe you live alone, there's no one there at home to help you. You could go from the hospital into an inpatient rehabilitation facility to continue your physical therapy before you're stabilized to go home. Medicare will cover up to 100 days of inpatient rehab in this case. The first 20 days, Medicare covers it in full. Now, you pay nothing for the first 20 days of rehabilitation in an inpatient facility. For day 21 through day 100, you have to pay $185.50 per day, and Medicare picks up the balance. If you're in a skilled nursing facility for more than 100 days, you then have to pay the room and board, but Medicare will continue to cover the health benefits for you, your doctor's services, your physical therapy, etc. So notice here, Medicare does not cover what's called long-term care. If you need to permanently move into a nursing home for care, Medicare does not cover nursing home care. Right, so that's something you need to be aware of. Also, you're not entitled to the full 100 days. While you're in rehabilitation, the therapist in the nursing home has to submit progress reports to Medicare, and they might say after 21 days, you're ready to go home now. You can now continue your therapy as an outpatient or by getting home health care. So you're not entitled to the full 100 days rehab. Medicare might decide now you're stabilized and continue your care at home. Now at home, Medicare will pay for home care services like a visiting nurse to come in. They cover it at 100%, right? Medicare covers home health care at 100%. If as part of that home care, you need, say, a hospital bed, Medicare covers the rental of that hospital bed 80%, you're charged 20% for that. Medicare covers home health care as long as you need it, as long as you meet their medical criteria for needing home health care. But it is a limited benefit. They're not going to cover you for 24/7 nursing care. They'll pay for up to 8 hours a day, up to 28 hours a week is what the normal home health care benefit is. To qualify for home health care, your doctor has to write a prescription that you need it. You need to have a specific skilled level of care, meaning that you just don't need help getting in and out of bed or help getting dressed, but you need help from a nurse to come in to maybe look at wound healing, or a physical therapist to come in to give you physical therapy. So you need to have a skilled care in addition to needing home health aides to help you with the other activities of daily living. Criteria 3 is you must be homebound, meaning that you can only leave the house with assistance from somebody else or with great difficulty. Lastly, the agency that's providing you with that home care has to be a Medicare approved agency, and not all home health care agencies are approved by Medicare. Okay, I think I see a question coming in. Let me just stop here before I move on to part B. Okay, so question has to do with a Medicare supplement plan, and I will talk about the criteria for that. Okay, so now I'm going to move on to Medicare Part B. If no one, does anyone want to unmute their phone to ask a question before I move on to Part B?
I have a question.
Mm-hmm.
For, say for the home health care, do you have to get pre-approved through Medicare?
You need a doctor's prescription for it. So the doctor's prescription will go to the home health care agency, and they'll work with Medicare to make sure that you meet the criteria for home health care. And that would be these 4 criteria here that they're, when they're going to do an evaluation, and they'll see if you meet these 4 criteria.
Okay, so at that point, they could tell you, well, you're only allowed, you will only need 6 days.
That's
and
right.
That will be your responsibility.
That's
so
correct.
You have your upfront cost before you have to go anywhere or pay anything.
That's right. So they'll tell you based on your condition, what services you need, how many hours you're approved for the home health care, and that's covered at 100% by Medicare. And if you want to supplement that on your own, then you'll know what is getting paid for by Medicare and what you would need to supplement on your own. Yes.
Okay. And also, are these benefits covered throughout the nation or worldwide?
No, Medicare is a national program, so the rules I'm talking about here would apply anywhere in the United States. Medicare does not cover you for anything outside the United States, even if it's an emergency. So you're traveling to Paris and you fall and break a leg, Medicare does not cover you for care outside the United States. Original Medicare now that I'm talking about.
Okay, thank you.
Okay. All right, so I'm going to move on now to talk about Medicare Part B. So Medicare Part B is the medical insurance. It covers you for doctor's services, regardless of where you see the doctor. So even when you're in the hospital, Medicare Part A is covering the hospital costs, but the doctor's services that are treating you in the hospital will still go through Part B. It covers outpatient services, covers diagnostic testing and lab testing, outpatient therapy, physical therapy, occupational therapy. Medicare covers mental health services, so therapy, psychotherapy services. Covers home health services too, so home health is covered in both Part A and Part B of Medicare. Durable medical equipment, so things like oxygen, wheelchairs, walkers, canes, blood glucose monitors, those are all things considered in the medical equipment category. A lot of people ask that also includes CPAP machines for people with sleep apnea. That's also covered by Medicare. Medicare covers outpatient hospital services and ambulance services. Okay, so they only cover ambulance in an emergency situation. Medicare also covers a whole host of what's called preventive services, and Medicare covers these at 100%. There's no deductible or 20% coinsurance for you. So that includes things like a Welcome to Medicare physical and an annual wellness visit covered in full by Medicare. Then lots of the common screenings that we normally get, right, to test your level of cholesterol, screenings from a gynecologist, prostate screenings, right? So lots of screenings here. And I have a picture of the Medicare new handbook, because in the handbook, it goes into more detail on all of these screenings, how often you're entitled to get the screenings, what criteria you need to make to get the screenings. And they all have a little apple next to them, showing that it's part of the preventive benefit that Medicare will cover at 100%. Now, Medicare coverage for the COVID-19. Medicare Part B, the medical coverage, will cover at 100% testing for COVID, right? So if you want to go to be tested for COVID, that is covered by Medicare at 100%. The COVID vaccine is covered by Medicare Part B at 100%. That's all of the approved vaccines, the Moderna, the Pfizer, the J&J. Plus, Medicare will reimburse the provider administration fee for giving you the vaccine. So if you're going for a COVID vaccine and you're enrolled in Medicare A and B, there should be absolutely no cost to you. Part B is also covering, but they cover this at 80%, COVID treatment. So if you do get sick with COVID and need to see your doctor, Medicare will cover that at the normal 80%. If the doctor is going to prescribe you some other medication for the treatment of the COVID, cough medicine, flu-like medicine, Medicare would also cover that at 80%. Obviously, to go to see your doctor is covered. And now because of COVID and the shutdown, telehealth services have been expanded under Medicare. Medicare used to just cover that in rural areas. Now they're covering it everywhere. So you can have a telehealth appointment with your doctor. They can bill it to Medicare, and Medicare will cover that at 80%. Most important thing to know too is what's not covered by Medicare. So eyeglasses. Medicare only covers the cost of eyeglasses after you have cataract surgery. Routine dental care and dentures, not covered by original Medicare. And the third big one are hearing aids. So I would always advise folks that before you retire, if you have coverage from your employer for eyeglasses and dental care, get that before you retire. Next one I already mentioned, long-term care in a nursing home is not covered. Home with help from a home health aide, if that's the only help you need, help with bathing and dressing at home, not covered by Medicare. Acupuncture, not covered, except this year they did approve it for coverage for low back pain. Foot care, I'm talking about diabetic care, podiatry care, usually not covered unless you're a diabetic. Non-emergency medical transportation, not covered. Home modification, so Medicare will pay for you to have a wheelchair, but they will not pay for a ramp to be installed to get you in and out of the house with the wheelchair. And last one important, care received outside the United States. Medicare coverage is only covered in the United States. If you're traveling elsewhere or moving permanently outside the country, you're going to need to get coverage elsewhere. Medicare will not cover you there. So what does Part B cost? Part B has a monthly premium, and the amount of premium you pay is based on your income. The income they look at is modified adjusted gross income, and they normally look at your income from 2 years ago. So if you're applying for Medicare now in 2021, they're going to look at your last tax return. So for most people, that would be your 2019 tax return. If you file an individual return and your modified adjusted gross income was $88,000 or less, your monthly Part B premium is $148.50 a month. If you have filed a joint tax return as a married couple, if you earn less than $176,000, your premium is $148.50. If your income is higher, you see that there's a scale here, you'll pay a little bit more for your Part B premium. If you're collecting Social Security cash benefits, either as retiree or because you're disabled, this Part B premium gets deducted right from your Social Security check. It's an automatic deduction. If you're collecting, if you're starting your Medicare, but you're not collecting Social Security yet, right? You're waiting till your full retirement age, or maybe waiting till age 70 to get a higher benefit. You can still enroll in Medicare, and Medicare will bill you quarterly for these premiums. People that are in the higher tiers and pay a higher Part B premium, that is called an IRMA, income-related monthly adjustment amount. Okay, so people that pay a higher amount, they are assessed what is called this IRMA. And this IRMA is appealable. So say that maybe in 2019 you had a really good year and you made $110,000, but that was a one-time thing. You worked a lot of overtime that year, and now your income is less than $88,000. You can appeal it with Medicare to pay rather with Social Security, to pay a lower Part B premium. You would contact Social Security to appeal the IRMA amount if that's the case. Okay, other costs associated with Medicare Part B. In addition to having a monthly premium, there's an annual deductible, and that changes every year. This year it's $203. So you have to pay the first $203 of Part B covered services before Medicare will pay. Then after your deductible is met, there's a co-insurance. For most services under Part B, Medicare covers that at 80% of the Medicare rate, and you are billed 20% of the Medicare rate for that service. The next item is called an excess charge. Some doctors that are enrolled in Medicare do not take what is called assignment, meaning that they want a little bit more than the 80% that Medicare is paying them. And those doctors that do not accept assignment are allowed to charge you another 15% for their services. So they're going to charge you the regular 20% coinsurance and then another 15% excess charge on top of that. Okay, and these are combined together for your Medicare coinsurance. Now, most providers in New Jersey here do accept assignment and only will bill you 20% of the Medicare rate for the service. The ones we see that charge an excess charge are usually the highly specialized doctors. Anesthesiologists are one that typically don't accept assignment. But that's a question you can ask the doctors before you make an appointment with them. Now, most of these costs I've been talking about so far, your Part A deductible, that big $1,400 deductible, the per day cost if you're in the hospital for a really long time, and these Part B costs, the Part B deductible and coinsurance. Many people buy other insurance to help cover these out-of-pocket costs with Medicare A and B, and that's called a Medicare supplement policy or a Medigap, which I'm going to talk about in a moment. Some people don't need to buy a Medicare supplement policy. Instead, they have retiree health benefits from their former employer that acts as their supplement to Medicare. Okay, so if you have benefits from your former employer, that's your Medicare supplement. The coinsurance that you're charged, that 20%, is based on Medicare's fee schedule or what's called their approved amount. So the doctor can't charge you 20% of whatever the doctor wants to bill for that service. They can only charge you 20% of the Medicare approved rate for that service. Okay? Some services Medicare covers in full. There is no deductible or coinsurance, and that includes things like the flu shot, which is a preventive benefit, and home health care covered at 100%. So when you go to visit a doctor, they're going to say, no, we take Medicare, and that could be one of three things. That could mean that they are participating with Medicare, and that means that all of their claims they send to Medicare, they take assignment for, and they're only going to bill you the 20%. Other doctors are non-participating Medicare doctors. That doesn't mean they don't take Medicare. It means they are enrolled in Medicare, but they, for some of the claims they send to Medicare, they might then charge you 35% of the Medicare rate for that if they're non-participating with Medicare. Lastly, some providers don't take Medicare at all, and that term is called opted out. Those doctors have to let you know verbally and in writing that they do not participate at all with Medicare, and you're responsible for the full cost of that care. Okay? By signing this agreement with this doctor, you're agreeing to pay out of your pocket for the care. It also means you cannot send that claim to Medicare to get reimbursed. Medicare will only pay for services from providers who are enrolled with Medicare as either participating or non-participating. You're going to get quarterly a Medicare summary notice in the mail from Medicare. That notice is going to list all the claims that Medicare has received under your Medicare number for both Part A and Part B. It'll tell you the date of service, the provider's name, and what the service was that that doctor is billing for. They'll tell you if the service was approved by Medicare, yes or no. It'll tell you how much that provider charged. That number does not mean anything. Okay? The number that is important to you is the Medicare approved amount for that service and what Medicare paid and what you may be billed. So Medicare is going to pay 80% of the approved amount, not 80% of what the doctor billed. You can be billed 20% of the Medicare rate, not 20% of whatever that doctor billed Medicare. Okay, so carefully read your Medicare summary notices to make sure that all of the claims that were sent to Medicare using your number were actual services that you did receive, and make sure that Medicare approved them and you're paying the right amount on any bills that you receive. Okay, question came in, as my income drops after employment, does the Part B premium drop? Yes, every year at the end of the calendar year, Social Security will work with the IRS to look at your tax return, and if your income went up or down, they will adjust your Part B premium accordingly based on that last tax return. Another way to view your Medicare claims rather than wait for the quarterly Medicare summary notice is to register online. The website is called mymedicare.gov, or you can just go to medicare.gov and register that way. Do not go to mymedicare.com.org, right? The official government website is GOV. You can register there and you'll be able to see your Medicare enrollment information online, as well as seeing all of your claims for Part A and Part B that were sent to Medicare using your number. This is what the Medicare card looks like. It's referred to as the red, white, and blue card. It'll have your name on it and a Medicare number. That number is called an MBI, Medicare Beneficiary Identifier. It's a mix of letters and numbers, and it's a random mix of letters and numbers. That Medicare number has no clues in there as to how old you are, when you're enrolled in Medicare, or anything. It's a random mix of letters and numbers. It'll also say on your card if you have Part A and or Part B and what date those parts are effective. So some people start A and B on the same date. Some people might have Part A but not Part B yet. So right, they're going to delay their Part B because they're still working. So some people, their Part B effective date will be later than their Part A. So I've talked about original Medicare, Part A hospital and Part B medical. And I talked about all those deductibles and coinsurance you have. The only thing you have is Medicare. Now I want to talk about supplemental insurance to help you cover those Part A and Part B out-of-pocket costs. So one way to supplement Medicare and help you pay those out-of-pocket costs is to health insurance from your current or your former employer or your union. So retiree health benefits can help you pay these out-of-pocket costs. If you don't have access to retiree health benefits, you can buy a policy called a Medicare supplement, also known as a Medigap policy. Or you can simply stay with Medicare A and B and pay out of your pocket those deductibles and those copays. If you are very low income, and I'm talking about a single person earning less than $1,000 a month, that's considered very low income, you can get help from the state Medicaid program to help you with these Medicare costs. And I'm going to talk about that at the end. If your supplemental insurance is from your former employer in the form of retiree health benefits, you want to find out from your employer, how does your retiree health plan coordinate with Medicare? And that's the word you want to use, coordinate. That's an insurance term. So in other words, when your doctor sends the claim to Medicare, how is your retiree plan going to get that claim after Medicare does it, after Medicare pays it? Many retiree health plans have what's called crossover set up. When the claim goes to Medicare, Medicare will then process the claim and then automatically send it on to your retiree health plan. Okay, so you don't have to do anything, your doctor doesn't have to do anything. The other thing to ask about your retiree plan is how much is it costing you? Many retiree plans are not free anymore and you have to pay something for them. So know what the cost is. Know if that plan has a deductible that you're going to have to pay before that plan will pay. Know if your retiree plan includes drug coverage or not. Because remember, you can get drug coverage from Medicare, but you may not need it if you're getting it from your retiree plan. Also know if your spouse is covered under that plan, to know whether your spouse needs to get their own retiree insurance or supplemental, or can they stay under your plan. But know that this most important thing in red on the bottom, if you are retiring with the retiree health benefits and you're age 65 or older, you need to enroll in both Medicare Part A and Part B when you stop working in order for your retiree plan to pay in full after Medicare pays. You need A and B to work with your retiree plan. The only exception to this that I'm aware of is if you work for the federal government. If you are getting benefits into the federal employee health benefits plan, they do not require you to have Medicare, but every other company does. Okay, so what is this Medigap policy that I mentioned? Medigap policies are sold by insurance companies, right? The Blue Cross Blue Shield, Aetna, United Healthcare, etc. And they cover the cost gaps in original Medicare, right? So that Part A hospital deductible, the per day hospital stay and a long hospital stay, the co-pays in a skilled facility if you're there for rehabilitation, the 20% for doctor's visits. They cover those cost gaps in original Medicare A and B. And this Medigap is also called Medicare Supplement Insurance. The policies that are sold are what's called standardized, and they're labeled by letter A through N. Standardized means that a Plan A from Horizon has the exact same benefits as a Plan A from United Healthcare or Aetna or anyone else. The plans all have the same benefits of the same letter. What is going to differ is the cost of the premium and how each company calculates their premium. So you're getting the same policy, the same coverage, the same benefits, but each company is going to sell that at a different cost. When you have original Medicare Part A and Part B and a Medicare supplement policy, no matter what the letter, you can go to any Medicare doctor, any hospital, any provider, anywhere in the United States that accepts Medicare. There's no network to follow, there's no prior authorization, there are no referrals. So it gives you the most freedom of choice and flexibility as to where you get your care. When you purchase a Medicare or a Medigap supplement, you do have to pay extra for that. So you're going to continue to pay your Part B premium of $148 to Medicare, but in addition, you're going to have to pay a monthly premium for the supplemental policy. The amount that you pay is based on which letter plan you choose and based on your age. These policies are kind of like life insurance, and that every year you age, your premium is going to go up just by the fact that you're getting older. It has nothing to do with your health condition. It's just going to go up on the fact you're getting older. So at 65, you can get a Medicare supplement policy close to about $100 a month, but at 85, you're going to be paying closer to $350 a month. Okay, so it ranges by age. When you have Medicare and Medigap policy, the claim goes to Medicare first, Medicare pays first, and then the Medigap pays after Medicare. The Medigaps only cover services that Medicare covers. So these policies don't cover you for eyeglasses and dental and hearing aids. They only cover the things that Medicare covers. Most important thing to know about Medigaps, and someone did chat in this question, is when can you buy it and not worry about being turned down? When you start your Medicare Part B, as in boy, that's your Medigap open enrollment period. The first 6 months, starting your Medicare Part B, as in boy, you can apply for any Medigap to any Medigap company, and they cannot turn you down based on your health conditions. Okay, so the first 6 months of your start of your Part B of Medicare is your Medigap open enrollment, where you can get a Medigap, no questions asked. They have to give you the policy at the best price. They're not going to ask you health questions and charge you more if you have some health conditions when you're applying in that first 6 months. After those 6 months, if you apply for a Medigap, then yes, they're going to ask you medical questions and they could turn you down if they feel you have a lot of health risks. Or they could charge you more for the Medigap in terms of the premium if you have some compromising health conditions. Okay, so you want to get it as soon as you start your Part B, because you run the risk of not being able to get a Medigap or for paying more for it. Also, these Medigap policies do not cover prescription drugs. They only cover Part A and Part B services. So you would need a separate Medicare Part D drug plan to work with Medicare A, B, and your supplement. Too far. Okay, what we call this the STAR chart, and this is available on our State Division on Aging website. It shows all of the different letters, Medigap policies you see here, A, B, D, G, F. You see some letters are missing there, right? There's no, there's no H, there's no J, because those are older policies that have been phased out over time. So now these are the letters that are sold that are highlighted here in yellow. In blue, you see Plan C and F. These Medigap policies are no longer sold to people who turned 65 as of 2020. Okay? So Plan C and F are still out there, and some people still have them and can keep them. But if you turn 65 in 2020 or later, you cannot get Medigap C or F. This chart shows you what's covered when. So Medigap policy A, that has a star in certain things. So policy A covers the 100% of the hospital co-payments, but it doesn't cover the hospital deductible. The most comprehensive Medigap policy you can buy right now is Medigap policy G, as in girl. You see that has a star in just about every single box. What the G doesn't cover is the Part B annual deductible, that $203. So none of the Medigaps sold now will cover that first $203, that Part B deductible. Right? If you buy a Plan G, after you pay the first $203 in the Part B deductible, then Plan G pays all of those Medicare A and B costs. Now you pay a monthly premium for your Plan G, but then Plan G will pick up all the other deductibles and co-insurances for the rest of that year. Okay, so that's how you would read this chart here. And this is available on our Division of Aging website. Many things we're now seeing offered by the Medigaps are what we call supplemental benefits. When I talk about Medicare Advantage plans in a moment, you'll see that those HMO plans have a lot of perks, like they'll cover you for dental and vision and so on. So to keep up with that, we are seeing some Medigap companies now, including some discounts for those optional services. So we know that United Healthcare, the AARP plans, they have offered discounts to people with their policies for dental care and eyeglasses, as an example. Some companies are offering discounts on home health care, so you need to check with the company to see what additional discounts they offer to their policy holders. This chart is also on our Division of Aging website. These are the rates for Medigap policies for females, because the rates do differ based on your gender. So we have the pink chart is the female rates, and then we have another chart that has a blue banner. Those are the male rates. And these are the rates for someone at age 65. If you are 66 or 67, you're going to pay a higher amount. So we list here all the insurance companies currently selling Medigap policies in New Jersey, and then we tell you their premium for the different letter policies. So looking at this chart, if you can see it, it might be too small. For Medigap policy G from Humana, their value Medigap is $127.50 a month for females age 65. If you wanted to get that same policy G from Aetna, their monthly premium is $142.69. So it's the exact same benefits you're getting, but each company calculates their rates differently, so the premiums are different from company to company. Medigap premiums are based on a number of factors. One of them, are you in your Medigap open enrollment period, right? That first 6 months of your Part B, they have to give you their best rate for that policy. It's based on your age, so they have different rates no matter what your health condition is. The rate you get is going to be based on the current age that you purchase the policy, and then will change every year after that. Some policies, they differ the premiums based on where you live in New Jersey, so it's zip code based. Some companies, if you're applying for your Medigap more than 6 months after you have Part B, they have smoker and non-smoker rates. So obviously, smokers will pay a higher rate than the non-smokers do. Most of the companies now have different rates for males or females. That didn't used to be the case, but now all of the companies do have different rates for males and females. So a lot of factors go into what rate you're going to pay for your Medigap premium. To get more information about Medigaps, in addition to those two charts I just showed you that are on our aging.newjersey.gov website, you can get a book from Medicare called Choosing a Medigap Policy. It's a free book you can get by calling 1-800-MEDICARE, or if you go on the Medicare website, you can download the publication there. Okay, any questions about Medigaps? So I'm going to stop here for questions here. Let me just see what we've got here. Scroll up here. So if you start, the question came in, if you start Medicare Part B at 70, you can still get a Medigap without underwriting. Yes, because when you start your Part B, that first 6 months of your Part B, they have to give you the policy without underwriting, correct? Question, is there any way to find out which companies are more reputable than others to avoid companies that might be difficult to work with? So Medicare itself does not rate supplemental policies in terms of star ratings or anything like that. But you can go you can contact our Department of Banking and Insurance. If you're working with an insurance agent, they can tell you the premium history of a particular policy with a particular company to know how much their rates have gone up in the last couple of years, to see their history. But all of the policies sold in New Jersey are approved by our Department of Banking and Insurance. They have to, all the insurance companies have to submit all their actuarial information to banking and insurance, and they do approve those rates and the companies offering those policies. So they are vetted in that way. If you really, it's no risk for you. If you do buy a Medigap from a company that then goes bankrupt, you are protected. Medicare says that if you lose your Medigap because your company went bankrupt, we'll now allow you to get any other Medigap from any other company without any underwriting, that you can't be turned down. So it really is no risk in terms of if you're afraid the company might not last. A question, do states have different policies? Yes, all of the states have these letter policies in terms of the A, B, G, N, and so on. So that is standardized nationally, but the companies that offer those policies are different from state to state. Also, some of the rules are different. Here in New Jersey, companies are allowed to medically underwrite after 6 months of Part B, where they can turn you down, whereas in New York State, they can't do that. In New York State, you can get a Medicare supplement policy at any age and under any health conditions, and they have to issue that policy. But because of that, their premiums are much higher in New York. Because our companies are pickier here in New Jersey, our premiums tend to be lower. Also, Medigap policies are what's called portable. So if you purchase your Medigap here in New Jersey and then decide to move to Florida, that policy travels with you and you can keep that policy anywhere else in the United States. Okay, so you don't have to change Medigaps when you move out of state. How do you enroll in a Medigap? You would enroll in a Medigap by contacting the company directly or by contacting an insurance agent. 1-800-Medicare does not offer Medigap policies. They have to be sold by licensed insurance agents, and some of them allow you to do it over the phone. Some of them require you to meet with an agent to do that. Questions: are there factors to consider when picking your company once you decide on what letter? Well, some people just go by price. So you know if you want a plan G, you look down the list, see who has the best price for plan G and go with that company. Other people like to do a little bit further investigation to find out what the history has been for those companies in terms of how quick they raise up their premiums. Okay, question: can you get Medicare A and B with a Medigap if you also have your work health care? Not necessarily. If you have in coverage from your employer and you're still actively working for a large employer, if you call an insurance company to get a Medigap, one of those questions on there is, what insurance do you have right now? And the company's not allowed to sell you a Medigap policy if it's going to give you the same type of coverage you already have from your employer. Okay, so typically you don't need a Medigap policy if you have either insurance with your current employer or even a retiree plan. It's usually one or the other. In some cases, you can have both. Maybe your retiree plan has a really high deductible, so you want to get a supplement to help you cover those costs in between that. You'd have to work that out with the insurance agent to see if it qualifies for you to get a Medigap or not, or if it's considered too much of a duplicate coverage. Okay, can you get a Medigap at any time, say 70, and consider yourself in good health? So yes, if you just have regular Medicare A and B and you're healthy, and now you decide it's time to pick up a supplement policy, you can apply at any time for a supplement. They will ask you medical questions and look at your medical history. And if you're healthy, yes, they will issue you a policy. But that's a big risk you're taking, right? Going with just A and B without a supplement, you don't know when a chronic or a health life-threatening health condition is going to affect you. And if you wait too late, you may not be able to get that supplement policy. So you're running a risk by waiting, by not getting the supplement as soon as you're eligible with your Part B. Question: if you are retired and your income drops to under $1,000, is that considered Medicaid? Yes. Medicaid eligibility is income of less than $1,000 a month, and also assets. They look at what savings account, checking account. You have to have less than $2,000 in assets to qualify. Does the payment for Medigap back come out of your Social Security? No. To pay the premium for your Medigap, you either will get a coupon book and pay that monthly to the company, or you can set it up where it comes directly out of your banking account. Medicare does not get involved in paying premiums, or Social Security also does not get involved in paying the premiums for your Medigap policy. So that's a good question. So does anyone want to unmute their phone to ask a question over the phone?
This was fabulous. Is there any way I could see or hear this again?
I'm not scheduled right now to do another one, but I have been doing this twice a year with Capital Health. So I'll probably be doing another presentation like this in October. And I do believe they are recording today's session. So you can reach out to Capital Health about getting a copy of the recording.
That's right. We will have it recorded and it will be up on the Capital Health YouTube page shortly. And also keep in mind that you will all be getting a copy of this presentation in PDF format in your emails after this lecture.
Okay.
I have a question. I'm on Medicare Part A and B. I'm still working, but I have my husband's state employee insurance and I use his pharmacy plan. So as long as he's alive, I get that. If he passes away, then I have to get a supplement plan and a Part D plan.
Is your husband working?
No, he's retired.
Okay, so, but you also have health benefits from your employer, correct?
No, I don't.
Okay.
I'm just on,
Okay, so if you're covered under your husband and your husband is not working, you need to enroll in Medicare A and B, even
I
if
am.
you are.
I am, yeah.
You are, okay, great, yep. So, yeah, so when, under state health benefits, if you're gonna lose his benefits when he's no longer with us, then at that time, you can either get a supplemental policy or Medicare Advantage, that I'm gonna talk about, or a Part D plan, yes. When you lose other coverage, that gives you what they call a special enrollment to pick up Medicare coverage if you're losing retiree coverage from your spouse, yes.
So with a supplemental insurance, is the prescription already included, or
It
you
is
have
not.
you
It
have to
is
get a
not.
separate Part D?
That's correct. I'm going to
Okay.
talk about that right now, yes.
Okay,
Okay, so.
thank you.
You're welcome. So I've talked about Part A hospital, Part B medical, and Medicare supplement insurance. I can get back to my slides. Now I'm going to talk about this Part D prescription drug plans. So as our last person just said, when you have original Medicare, A and B, and a Medicare supplement policy, none of those parts of Medicare cover you for prescriptions that you get at the local pharmacy. For that coverage, if you don't have access to it from your retiree plan, you need drug coverage from Medicare, and that's in the form of a Part D Medicare prescription drug plan. So these plans are called standalone prescription drug plans, and they're not administered by Medicare directly. Instead, Medicare contracts with insurance company to administer this drug benefit. And they're offered by the same common names you know, United Healthcare, Aetna, Horizon Blue Cross Blue Shield, all offer Medicare Part D prescription drug plans. It's another type of insurance policy that you can buy, but it just covers you for prescriptions, doesn't cover you for doctors or hospitals or any other healthcare service. Your other way to get prescription coverage from Medicare is to enroll in what's called that Part C of Medicare, Medicare Advantage plans. These plans, also sold by insurance companies, combined health benefits and drug benefits together. So you can get credit for having prescription coverage if you enroll in a Medicare Advantage plan that has that drug benefit. Last way is if you have drug coverage from another source other than Medicare. Like the woman who just spoke, she has coverage from her husband's retiree plan that includes a drug benefit. That's called creditable drug coverage. So Medicare gives you credit for having drug coverage from another source. And when you need to switch from that onto a Medicare plan, there's no late enrollment penalty for you because you had drug coverage from somewhere else. So they're going to allow you to move over to Part D when you no longer have that other coverage without any type of penalty. Here in New Jersey, we have 30 different Part D plans to choose from, and it does differ from year to year. And again, various insurance companies offer this product. Some plans are national plans where if you are a snowbird or you travel quite a bit, you can fill prescriptions at pharmacies outside New Jersey. Congress, when they created this Part D drug benefit, they specified that they're only going to cover medications available by prescription. They don't cover anything over the counter. The Part D plans have to cover both brand names and generic drugs. They also have to cover insulin and the supplies for injecting insulin, right? So insulin is not considered a medical benefit under B, but you would fill it under Part D drug plans. Part D also covers some vaccines, and that would include the shingles vaccine, both Zostafax and Shingrix that's available now. All of the Medicare Part D drug plans have to cover that. There are some exceptions. I mentioned the COVID vaccine is covered under Part B. Also, the flu shot, pneumonia shot is still covered under Part B as a medical benefit. All of the Part D insurance plans that are sold have a list of drugs that they cover, and that list is called a formulary. And each 30 of those 30 plans have a different formulary. There's no standardization in terms of who covers what on the Part D plans. So you have to be careful when looking at these plans to make sure you enroll in one that covers the prescriptions that you take. In addition to the formulary, the plans place their drugs in what's called cost tiers. And normally there are 4 or 5 tiers in each plan. Normally what they call preferred generics or tier 1. The more costly generics might be tier 2. Then maybe brand name drugs might be tier 3. And obviously, the higher the tier, the more costly the copay is going to be for the drugs. But this differs from plan to plan. So AARP might have your drug as a tier 1, but Aetna might have it as a tier 2. The drugs decide what the plans, insurance companies decide what tier to place the drugs in. Some categories of drugs by law are not covered by Medicare Part D plans. Those include things like prescription vitamins are not covered. Prescriptions that are considered cosmetic, like Rogaine for hair growth. Medicare also does not cover what they call lifestyle drugs, so that would be the Viagra class of drugs, and there are some other things like a medication for weight loss or weight gain not covered. Among the different plans, Part D drug plans, in addition to having your drug on the formulary and on a different tier, they can have 3 types of restrictions on the drugs they do cover. So some drugs might have a quantity limit on it, where the plan might cover you for maybe 60 pills a month, but if you need more than that, the doctor's going to have to give medical evidence if it's beyond their quantity limit for that medication. Another type of restriction a Part D plan can have is prior authorization. They're going to require you to submit information from your doctor before they're going to approve you to get that medication. And that's usually on very expensive medications that require prior authorization before they approve the paying for that drug. The third one and last one is called step therapy, where a Part D insurance company will say, yeah, we have this drug on our formulary, we cover it on one of our tiers, but we want you to try something cheaper first to see if that will work. Then if that doesn't work, you can step up to the original prescription. All of these 3 restrictions can be appealed with your doctor's help to get the drug plan to cover the drug that you need. Now, the other factor when looking at Part D plans are the pharmacies that work with the various insurance companies. So all of the Part D plans have a network of pharmacies that you can use when you have their coverage. In addition, now many of them within their network have what they call standard pharmacies and preferred pharmacies. And if you use the preferred pharmacy in their network, you're going to pay a smaller copay. For an example, we have a plan called the Humana Walmart plan. You can go to many different pharmacies. You don't have to use Walmart in that Humana Walmart plan. But if you use the pharmacy at Walmart, you'll pay a lot less money in terms of copays for your prescriptions. Okay? So know what the preferred pharmacies are in any plan that you're enrolling in. So the cost of the Part D plan, these change every calendar year. And this year, the premium range are low as $7 a month up to $95 a month. So it's a broad range on these 30 different plans what their premium is. The average is about $40 a month premium for the Part D plans. Some of the plans have a deductible before they'll pay for your medications, and Medicare caps that every year. This year, the maximum deductible a plan can have is $445. Then after the deductible is met, you go into what's called the initial coverage period. During this phase, when you go to the pharmacy, you're going to pay a copay for each prescription or a co-insurance, a percentage of the cost of the medication, and then your Part D Medicare plan will pay the rest. You're going to stay in this initial coverage period until the total amount of drugs you received for that calendar year reaches $4,020. So that means adding up everything you paid at the pharmacy counter, plus everything your Part D plan paid towards the cost of your medications. Those 2 things, if they add together and hit this $4,020 mark, you then fall into the coverage gap, which most people call the donut hole. So $4,000 worth of medications is quite a bit. Most people do not hit that amount of money, and they stay in that initial coverage period all year. But if you're, say, a diabetic on insulin or taking diabetic medication, those are pretty expensive, and you're probably going to hit that $4,000 mark and go into the coverage gap. If you do, another name for this is the donut hole. While you're in the coverage gap, your cost for your medication is 25% of the cost for each generic drug you take and 25% of the cost for each brand name drug that you take. Now, for the brand name drugs, there is a discount, right? So you're paying 25% for the brand name drug. Whatever drug company makes that drug, they're paying the other 70%. And then Medicare pays the final 5%. What's good about this is the 70% paid for by the drug manufacturer counts as if it's coming out of your pocket to get you out of the donut hole faster. You will get out of this coverage gap or donut hole when your total out of pocket for the year reaches $6,350. So that includes whatever you paid during your deductible phase, whatever you paid at the pharmacy during your initial coverage period for your medications, the 25% you paid out of your pocket in the coverage gap, and the 70% paid by the drug manufacturer for any brand name drugs you take. That all goes in towards the $6,000 figure. If you hit that amount, you then go into the final benefit called a catastrophic benefit, where you had a small copay for the rest of the year. So this is very overwhelming, very confusing. I understand it. Most people, though, don't have to worry about the coverage gap or the catastrophic benefit. Most people are just going to stay in this copay phase for most of the year. In addition, whatever Part D plan you enroll in, they're going to send you a monthly statement called an EOB, Explanation of Benefits. And they're going to tell you where you are in these different benefit stages. They're going to say you're in your initial coverage period, you've got $1,000 more to spend before you hit the coverage gap, as an example. So they'll tell you where you are, so give you a heads up as to how close you are to hitting the gap, or if you're in the gap, how much more to spend before you get out of it. So because there's 30 different plans to choose from, there's these formularies and these restrictions to have to worry about. The way that you want to compare the plans to pick the right one for you is based on 4 different factors. The first factor is coverage. You want to choose a Part D plan that covers the prescriptions you're currently taking. Notice that I'm saying that coverage is more important than cost. There's no sense enrolling in a $7 a month premium plan if it doesn't cover your medications. So coverage is the first factor, and you want to look for plans that don't have any of those restrictions on the medications you take, like step therapy or prior authorization. Then you look at cost. So once you narrow down that list of 30 plans to the ones that cover all your medications, now you compare the cost among them. And that cost you want to look at is called the total estimated annual cost. You're going to add up the premium to be in the plan, all the deductibles and all the copays to get a total figure, and they're going to use that to compare one plan to another. Then you're going to look at convenience. I talked about some companies have mail order, some don't, and these preferred versus standard pharmacies. So if you like to use the local Walgreens on your corner, you might want to look to a Part D plan where Walgreens is the preferred pharmacy for the plan to save the amount of money, best amount of money. Lastly is coordination. If you get help paying for your prescriptions from one of our state assistance plans, I'm going to talk about in a moment, that only works with certain Part D plans. You want to make sure you enroll in a plan that will coordinate with the subsidy. In order to do this comparison, Medicare has invested a lot of effort and money into coming up with what they call a plan finder tool. This is found on the Medicare website. Again, it's medicare.gov, G-O-V, don't go to medicare.com. And on there, you're going to click a button that says Find Health and Drug Plans. And this is what it'll look like. It's a Medicare Plan Finder. You can create an account here and list in your medications, and then it'll save that list in your account, or you can just continue without logging in to compare the different plans that are available. When you go into the plan finder, you're going to type in the list of prescriptions that you take. Then it's going to sort through the formulary of all of those 30 plans and come up with you a list of the plans that cover your prescriptions at the best price. So they make it pretty simple to choose a plan among the 30 that are available. You can do this on your own computer, Or you can call 1-800-Medicare and give them the list of your prescriptions and they'll do this comparison for you. Or you can meet with one of our SHIP counselors who can help you do this and do this comparison with you. Okay, that's creating my Medicare account or continue without logging in. So what if you do your homework and you join a plan that covers all of your prescriptions, but now in the middle of the year, you get a brand new prescription from your doctor? Medicare says you can only enroll in a plan when you're new to Medicare, and then in the fall, during the open enrollment period, you're allowed to switch. Beyond that, you're locked into that plan for that year. So if you get a new prescription and you find out your plan doesn't cover it, what can you do? Your first option is to find out from your plan which drug in that category it does cover. So say you got a prescription to lower your cholesterol, and there are many drugs approved for that condition, but the one the doctor wrote you, your plan doesn't cover. Find out what other cholesterol lowering medication your plan does cover and see if your doctor is willing to switch your prescription to that drug. If the doctor comes back and says, no, this is the best one for you, your doctor can then work with your Part D plan to request what's called an exception, to get the plan to cover that drug on its formulary just for you because the alternatives will not work for you. If the plan comes back to deny that request, you have the ability to appeal that, and there are 3 different levels of appeals that you can go through. Or if you are going to pay cash for that drug because the plan doesn't cover it, next time open enrollment rolls around, you want to change plans to find one that will cover all of the drugs that you take. Okay, I just want to see some of the questions that have chatted in. What determines the drug plan costs? So again, the drug plan costs are the premium that you're paying, the deductible in the plan, and what copay the plan has for the prescriptions that you take. Question, I don't take any medications. Can I enroll at a later date? Well, that's a very timely question, Nancy. Thank you. So if you don't enroll in a Part D drug plan when you're new to Medicare and you go without having any drug coverage at all because you don't take any prescriptions, Medicare gives you that option, says you don't need to take it right away. But if you want to enroll later, they're going to charge you a Part D late enrollment penalty. So that's for people who enroll in a Part D plan after a period of time of being on Medicare and not having any prescription coverage. The penalty that you pay is 1% of the national average Part D premium multiplied by the number of months, not years, the number of months you are without coverage. So, and that's added to the premium of whatever Part D plan you enroll in. So as an example, if you delay enrolling in a Part D plan for 3 years, that's 36 months, your penalty is 36% of the current national average premium. That comes down to $11 a month that you pay in addition to the premium for your plan for being enrolling late. That penalty never goes away. So if you wait the 3 years and you enroll at 68, you're going to be paying a monthly penalty on top of your premium for the rest of your lifetime while you have a Part D. So what we normally tell people is, if you don't take any prescriptions, just enroll in the lowest cost Part D plan, and we have a plan that's $7 a month. This way, you have coverage just in case you need it, right? Many of us get a prescription even just for a one-time thing, like for an antibiotic, and you're avoiding this late enrollment penalty later on. So if you don't take prescriptions, just enroll in the lowest premium plan available at that time. And this year for 2021, we have one that's $7. Okay, I don't see any other questions about this. Does anyone want to open their phone line to ask a question? Okay. So I've talked about so far everything that works with original Medicare, Part A, Part B, supplementals, and Part D. Now I want to talk about another option that you have. Instead of getting all these different insurance pieces to work together, you have another choice, and that's to get what's called Medicare Advantage. That's Part C of Medicare, and it combines hospital coverage, medical coverage, and prescription coverage all together in one plan. Okay? One ID card, one plan to cover you for all of these things. These Medicare Advantage plans are offered by private insurance companies that contracts with Medicare to administer this benefit. They're called Medicare health plans, and they're all what's called managed care. They're HMOs or PPOs. When you enroll in Medicare Advantage, you must get all of your Medicare services through that insurance company. No claims now will go to original Medicare. So because this is managed care, you now can't go to just any Medicare doctor. Now you have to use specific doctors and hospitals and labs that are in network for the plan you're enrolled in. Plus, because it's managed care, you might need referrals before you can see a specialist, and you might need prior authorization before you get certain services. The advantage part of these plans is normally they give you extra benefits that you're not getting in original Medicare. Many of these plans offer you coverage for eyeglasses, hearing aids, and dental. But you carefully want to look at these extra benefits because many times they're very limited. Some of the dental benefits that they're offering might just be for a routine checkup and a cleaning and are not comprehensive dental benefits to cover you for anything more than that. So look carefully at the extra benefits of the Medicare Advantage plan that you're interested in enrolling in. Again, Medicare Advantage is not a supplement to Medicare. Instead, it's an alternative way to get your Medicare benefits through an HMO or PPO type of product. When you enroll in Medicare Advantage, you still pay your Part B premium to Medicare because Medicare uses that money to pay the Medicare Advantage plan towards the cost of your care. Plus, you might have an additional premium to pay for the Medicare Advantage plan. I say some because there are a lot of plans that don't have a monthly premium. But your cost sharing for services are going to be different in Medicare Advantage than they were in original Medicare. There's no such thing as the 20% co-insurance or that big hospital deductible. When you're in Medicare Advantage, the plans set the copay for the various services that they have, and it differs from plan to plan. There's no standardization in Medicare Advantage. Plus, with Medicare Advantage, they do differ from county to county. So plans available to people living in Mercer County are different than the plans available to people living in Somerset or Hunterdon County. It differs from county to county. The premium range on these plans are $0 to $198 a month, a very big range on the premiums that the plans offer. We do have 27 plans that have a $0 premium. We have a couple of plans that are $0 premium, plus they'll help you pay your Part B as in boy premium. Any Medicare Advantage plan, though, that has a premium at $100 or more is not a good value. You're better off looking at a Medicare supplement plan if you're willing to pay that much. Because when a Medicare Advantage plan at $100 a month premium, you're still going to have a high copay for all the services that you get. Okay? So they're usually not the best value. Some plans have a deductible before they'll pay for your cost of coverage, but all of the plans have a copay that you have to pay every time you get a service. So when I was talking about Medicare supplements before, right, I said that after you met that deductible, when you go to the doctor in the hospital, you don't pay anything. Your supplement policy picks it up. That's not the way Medicare Advantage works. Instead, with Medicare Advantage, you pay for the services that you use. What is a protection for you, though, in Medicare Advantage? All of the plans do have a maximum out of pocket. Normally, it's around $6,700. Some plans are a little higher, more like $7,500. So if you have a year where you're really sick, you're in and out of the hospital, seeing a lot of doctors, and your out-of-pocket costs hit the $67 amount, then for the rest of that calendar year, the plan will cover you at 100%, nothing out of your pocket for medical costs, okay? But that's a calendar year maximum, not a lifetime. Plus, these Medicare Advantage plans now are really expanding the number of supplemental benefits they offer. So many of them now offer more comprehensive dental benefits, like for dentures and root canals and crowns. Many of them are offering home-delivered meals free of charge to you after a hospital stay. And many are offering what they call over-the-counter spending cards. They'll give you like a Visa card that you can use to purchase things at the local pharmacy, things like adult diapers, Tylenol, aspirin, cold medicine, okay, and anywhere from $100 to $400 per quarter for these over-the-counter things. Some companies are offering you transportation to help you get to the doctor's office, and most of the plans are offering worldwide coverage for an emergency. So I said original Medicare doesn't cover you for anything outside the United States. Most of the Medicare Advantage plans will cover you for an emergency situation if you're traveling abroad. If you're considering Medicare Advantage, the biggest question is ask about the network. The doctors I like to use, the hospitals I like to use, are they in network for this Medicare Advantage plan? Then you want to look at the different copays they have for all the different services. What's the copay to go to the emergency room? What's the copay for physical therapy? Ask and know ahead of time what you're going to be responsible for different medical procedures. Know if the plan has out-of-network coverage. If it's an HMO, you're not going to be covered for anything but emergencies outside the network. Know if referrals are required to see a specialist, and look at their drug coverage. You don't want to enroll in a Medicare Advantage plan that doesn't cover any of your prescriptions, right? So carefully want to look at that drug benefit that's part of it. If you have an employer plan or a retiree plan, most of them only work with the original Medicare. They may not work with a Medicare Advantage plan. So if you have employer coverage, you pretty much have to stay with original Medicare and not enroll in a Medicare Advantage plan. Also look at the details on those supplemental benefits. Okay. Here's an example I have comparing the cost between Medicare Advantage and a Medigap. This is Mrs. Healthy. If Mrs. Healthy enrolled in a Medicare Advantage plan, she still pays her Part B premium every month, but she chose a plan that has zero premium for her Medicare Advantage. She doesn't have to pay her Part B deductible because that doesn't apply when you're in Medicare Advantage. But it does have copays when she sees the doctors, right? So in this plan, it's $20 copays to see a primary doctor, $50 copay to see a specialist. She had outpatient surgery, had a bunion removed. The copay for that in the plan is $125. She had routine dental and didn't pay anything because the plan covered that. And she got a pair of nice eyeglasses, and she only had to pay $100 for that. Medicare Advantage subsidized that. So the end of the year for Mrs. Healthy, she paid out $2,346. If instead Mrs. Healthy had stayed with original Medicare and picked up a Medigap G, she still pays her Part B premium, but she also, excuse me, has to pay a plan premium, the Medigap premium for her, $135. Plan G does not pick up the Part B deductible, so she had to pay that $200. But then all her doctor's visits and her surgeries were all covered in full by her Medigap Plan G. She did have to pay the full price for dental because the Medigap doesn't cover that. And she had to pay the full price for her eyeglasses of $500 because Medigaps don't cover that either. So the end of the year for Mrs. Healthy with the Plan G, her out-of-pocket is almost twice the cost as it was in a Medicare Advantage. Okay, now let's look at her husband, Mr. Sick. So if Mr. Sick enrolled in the same Medicare Advantage plan, that's zero premium, and he had a lot of doctor's visits. He had a hospital stay, and his plan had a $295 per day copay for a hospital stay. He had an ambulance ride, an emergency room visit, outpatient surgery, a lot of physical therapy. So he had a lot of copays in his Medicare Advantage plan. At the end of the year for Mr. Sick, his out-of-pocket was over $8,000. Now, his plan did have a maximum out-of-pocket, but I'm including in this calculation what he's paying for his Part B premium here. If Mr. Sick had a Medigap G, all of those doctor's visits and hospital stays and physical therapy would have been covered by his Plan G. End of the year, he'd be saving half that amount out of his pocket, just over $4,000. So you see the way Medicare Advantage and supplementals work. For healthy people, Medicare Advantage is more cost effective, but for sick people, Medigap is more cost effective. And the problem is we don't have the crystal ball to know what year, the year ahead, if we're going to be sick or healthy. Also, we can't jump from one to the other, because if we stay in Medicare Advantage when we're healthy and when we're sick, try to get a Medigap, we're not going to be able to get it. The company's not going to sell it to us. So you need to know ahead of time to either be prepared to have to pay a lot out of pocket if you're going to be sick with Medicare Advantage, or to start paying more money with the supplemental when you're healthy, knowing that if you do become sick, that's when you're going to save the money. Okay, I don't see any other questions chatted in. Enrollment periods really quickly. To enroll in a Part D plan or Medicare Advantage plan, you can do it when you're new to Medicare. You can do it in the fall in Medicare's annual open enrollment period. For Medicare Advantage, you have a couple of months in the beginning of the year to switch your coverage. And then there's special enrollments, like if you lose other coverage or you move out of state, you can change your coverage at that time as well. The annual enrollment period with Medicare is in the fall. You always want to review your Part D drug coverage. And if you're in a Medicare Advantage plan, you always want to review that plan as well in the fall. Really quickly, we do have programs to help people of limited income. We have a program to help that Part B premium for people. That program is called SLMB or SLIMB. You have to have an income of less than $1,449 if you're single for that program. And there is a resource test. So resource, they're talking about savings account, certificates of deposits, IRAs. If you qualify for help from the SLMB program, they pay your Part B premium, and you'll get an additional $148 a month in your Social Security check to use towards other expenses like food and rent. To apply for this program, you would apply at our Division of Aging Services toll-free number or on our website. We also have 2 prescription assistance programs in New Jersey. One's called PAD, P-A-A-D. That has a more generous income eligibility there for married and single couples, and there's no asset test. So they're not going to look at the money you have in a savings account, an IRA, or a CD, but they will look at any money you take out of it will be counted towards your income. Any interest that you earn from your investments will count towards your income. If you qualify for help for PAD, you pay no more than $5 at the pharmacy counter for generic drugs, no more than $7 at the pharmacy for brand name drugs. The PAD will pay the premium for your Part D plan. They'll pay the deductible in your Part D plan and all of those donut hole costs. You pay no more than $7 at the pharmacy counter all year round. To apply for that, it's the same number at our Division of Aging website. Lastly, we have a program called the Senior Gold Prescription Discount. That has a $10,000 higher amount than the PAD eligibility. And again, no cap on your asset or resources. With Senior Gold, you pay the first $15 of the copay of your prescription at the pharmacy counter, and then Senior Gold discounts the other half. So they split the remaining cost of the house with you. They do not pay the premium for your Part D plan, but they will help you at the pharmacy counter. Okay, so concluding reminders, in the fall is when you want to review and change your coverage for Part D plans or Medicare Advantage plans. Please avoid scams. We have 2 folks on the call today from our SMP of New Jersey that help people that report any Medicare fraud, waste, or abuse. Know that Medicare will not call you at dinner time. Social Security will not call you. Please protect your Medicare number just like you would your credit card number so that people cannot use that number for fraudulent claims to Medicare. If you have a question about the health insurance marketplace, know that if you are eligible for Medicare, you cannot get coverage on the marketplace, okay? That's only for people that don't have access to Medicare or Medicaid. Okay, and if you know someone who's not yet eligible for Medicare but needs health insurance, they can go to getcoverednewjersey.gov for coverage, health insurance coverage that's affordable there. Lastly, a word about my program SHIP, S-H-I-P, State Health Insurance Assistance Program. We are a free Medicare counseling program. We're funded by the federal agency. We help people navigate through Medicare. We give you information about your plan choices for Medicare. We can help you with questions or problems with enrollment or with claims. Our counselors are trained and certified by our state office. We have over 400 counselors throughout New Jersey to assist you. And the counselors are available locally. So in all 21 counties, we have counselors there locally to help you. We're unbiased. We don't sell anything or recommend anything. We have a website. If you just Google NJ SHIP, S-H-I-P, that's the easier way to get our website. And we have charts there of all the Part D plans, Medicare supplement plans, and Medicare Advantage plans. So if you are new to Medicare, these are your next steps. You're going to contact Social Security and enroll in Part A, and you're going to start the month you're 65. Unless you have a health savings account, you don't want to get Part A. You're going to contact Social Security to enroll in Part B to start the first of the month when your employment plan is going to end. And then you need to decide, do you want to get a Medicare supplement policy with a Part D drug plan, or enroll in a Medicare Advantage plan, or if you have retiree coverage, how's that going to work with your Medicare? You can go to, again, our website or call SHIP for charts of those programs, and you could call us for an appointment. We'll help you over the phone or through a Zoom appointment to meet with you one-on-one to talk about your options and for your particular case for your Medicare coverage. Okay, so again, I'll open it up to questions. Let's see, does anyone want to open your phone line to ask a question or make a comment? Okay, question came in, do Medicare Advantage plans cover you out of state? Let me just answer this. So Medicare Advantage plans will cover you for an emergency out of the state, but they will not cover you for routine care unless that Medicare Advantage plan has what's called a travel benefit. And
I have a question.
yes.
If I'm still working and I'm turning 65 this coming August,
Mm-hmm.
I can sign up for Part A Medicare?
Yep, as long as the coverage you have with your employer is not a health savings account, then yes, you can sign up for Part A and continue working and have your employer coverage. So Part A will just be extra hospital coverage you have that'll pay after your employer coverage.
Oh, so I need to check with my employer to see whether they, what did you just say in terms
A
of?
health savings account.
A health savings, right, a health savings
Okay.
account, right,
Yep,
okay.
as long as it's not that, then yes, go ahead and take your Part A. It's free coverage. And it's good to have just in case your employer coverage is limited in terms of hospital coverage or rehabilitation coverage.
Okay, thank you.
You're welcome. Okay. Anyone else have a question they want to ask over the audio?
I just want to remind everyone to please take some time to fill out the quick survey, and also after this lecture to please check your emails. There will be another survey for Mary in your inbox along with a PDF version of this presentation.
Okay, so again, you're going to be emailed out a copy of the slides. Going forward, we do have an 800 Medicare helpline at our Division of Aging Services. You can call that. We're open business hours Monday through Friday, 8:30 to 4:30. And in the email that you'll be getting will be a link to another satisfaction survey that my funding source is looking at some feedback from you. They want to know how our SHIP program is doing and educating Medicare beneficiaries like yourself about how to use Medicare. So please give me good marks. Okay, any other questions or comments from me? I know it was a lot of information, and that's why we're always here to follow up with you with any questions or to make a one-on-one appointment with you to walk you through it again.